Hello and welcome to the news from Bahrain International with me, Keith Johnston. The Minister of Foreign Affairs, Dr. Abdulatif bin Rashid Al Zayani, received today a phone call from the Minister of External Affairs of India, Dr. Subrahmanyam Jaishankar, in which they discussed the historical friendly relations between the Kingdom of Bahrain and India and ways to promote bilateral cooperation to serve the two countries' common interests. During the call, the Indian Minister of External Affairs expressed India's gratitude towards the government of Bahrain for providing constant care to the Indian community in the kingdom, which reflects the solid, friendly relations between the two friendly countries and people. He also noted the attention and care given by the competent health authorities to maintain the health and safety of the members of the Indian labour and provide them with the necessary laboratory tests and treatment which contribute to limiting the spread of coronavirus, COVID-19. Dr. Jaishankar also hailed the success achieved by the Kingdom in its continuous efforts to combat coronavirus, thanks to the strict precautionary plans and measures taken by the competent authorities in the Kingdom, wishing further development and progress to Bahrain and its people. For his part, the Foreign Minister expressed his appreciation to the Indian Minister of External Affairs for this kind gesture, noting the strong relations between the two friendly countries and people throughout history. He also stressed that promoting cooperation relations between the Kingdom of Bahrain and the Republic of India comes as a priority to His Majesty King Hamad bin Isa Al Khalifa, affirming the depth of the friendly relations between the two countries and people, and His Majesty's belief in coexistence, tolerance and brotherhood among nations. Dr. Al Zayani explained the efforts made by the government of Bahrain to combat coronavirus and precautionary and preventative measures taken by the competent authorities, aimed at protecting the health and safety of citizens, residents and expatriates alike. He also noted the royal orders by His Majesty the King to provide comprehensive care and free treatment for all residents and expatriates in the Kingdom of Bahrain and the application of the highest standards of healthcare to those receiving treatment, based on His Majesty's firm belief in the values of humanity and brotherhood among people. The Foreign Minister also emphasised that the plans adopted by the government and the competent authorities to provide healthcare and services to combat this emergency pandemic were praised by the World Health Organization, and that the competent authorities continue to exert all efforts to limit the spread of the virus and provide the necessary treatment according to the medical protocols approved for all existing cases with coronavirus. He also stressed the importance of the international community's solidarity in these exceptional circumstances and the unification of efforts, wishing the Republic of India and its friendly people further security, peace and prosperity. The Directorate of Inspection at the Ministry of Industry, Commerce and Tourism supervised the process of transporting in fruits and vegetables from storage spaces to retailers in the early hours of April the 2nd. The Directorate also inspected the prices of the food items across the country, which pushed prices down by 30%. The Ministry of Industry, Commerce and Tourism affirmed that this represents the first batch of foodstuff which has been stored and are being sold in the markets across the country, based on the needs of the market and within the determined prices. He added that these steps are part of a comprehensive plan, according to which markets would be inspected and the prices of food items would be monitored. The Minister affirmed that the Ministry will not hesitate in cracking down on any attempts at manipulating prices or hoarding food items, and that the maximum penalties will be applied to any violations as per Law No. 35 of 2012 on the consumer protection. He expressed hope that merchants will cooperate with these measures and assured citizens and residents every effort is being made to fully meet the needs of the markets and the consumers. The Ministry of Housing issued a statement noting that 1,100 comments and complaints have been recorded since the beginning of the year through the national system of Tawassul. It affirmed that it is working on finding solutions within the shortest possible time and that it aims to keep all citizens as close as possible to the Ministry through interacting with them and responding to them. The Ministry added that winning awards for 4 years in a row through the past 4 government forums, thanks to the support of the Tawassul programme, reflects its keenness on interacting with citizens and solving whatever challenges they may experience. The Ministry concluded by affirming its commitment to the objectives of the government to achieve high levels of performance. The Ministry of Health affirmed its keenness to enhance public health in the Kingdom through the untiring efforts of the Ministry of Health cadres in cooperation with the Ministry of Interior, which aims to ensure the health and safety of citizens and residents. The Ministry affirmed the continuation of field visits in cooperation with the Ministry of Interior within the efforts made in the national campaign to combat the coronavirus COVID-19 for a number of regions in Bahrain, with the aim of enhancing the health and safety of citizens and residents through an organised campaign in which mobile screening units, equipped according to the approved medical standards, the General Administration of Civil Defence and Service Police Personnel Society, alongside a group of volunteers. The Ministry indicated that medical team specialised in helping volunteers continues to take random samples and perform laboratory tests for elderly people and people with susceptibility to the coronavirus, in addition to owners of hypermarkets, groceries, refrigerators, bakeries and pharmacies in the Durat Al Bahrain area and the Manama area, Bab al Bahrain, as well as the area located in Bidayah Street, to ensure the safety and that of the families and all citizens and residents. In a related context, the General Administration of Civil Defence continues to carry out cleansing and sterilisation operations in some of these areas, explaining that maintaining the safety of all is a shared responsibility, while during the field visits, community service police personnel made awareness and education of various groups of society, including citizens and residents, and made sure that they follow procedures and necessary preventative measures. The Kingdom of Saudi Arabia implemented an earlier curfew and start time in the city of Dammam and the governorates of Al-Qatif and Al-Taif as part of the Kingdom's measures to slow the spread of the new coronavirus. According to the Ministry of Interior, the new curfew time, effective today, will start at 3 p.m. instead of the previously announced 7 p.m. The Ministry said curfew exemptions still apply to those in vital public and private sectors, such as security, military and media. Those who work in health services are also excluded from the curfew. Saudi Arabia also enforced a 24-hour daily curfew in Mecca and Medina until further notice. As of today, the Kingdom has recorded 154 new coronavirus cases over the past 24 hours, bringing the total to 2,039. Saudi Arabia's King Salman bin Abdulaziz Al Saud has ordered the government to bear 60% of the Saudi employees' salaries for a period of 3 months, amounting to 9 billion Saudi riyals, to support 1.2 million of those working in coronavirus-affected companies. The support mechanism will be in accordance with the conditions stipulated in the unemployment insurance system, which covers 100% of Saudi employees working in facilities that have 5 workers or less. It also covers up to 70% of companies where the number of Saudi workers exceeds 5. The decision will also exempt employers paying monthly wages to the employees during the compensation period. Companies, however, are not allowed to require workers to work during the compensation period. The United Arab Emirates reported 210 new coronavirus cases, raising the total number of cases in the country up to 1,024 infections. The Ministry of Health said the new cases were detected through testing people who came into contact with previously infected individuals, those who did not abide by the precautionary measures and social distancing, in addition to cases related to travel abroad. The new cases were from different nationalities, are all in a stable condition and are receiving medical care. 35 patients have recovered, raising the total number in the country up to 96. There were no new recorded deaths, keeping the death toll at 8 people so far. Iran's death toll from new coronavirus rose today to 3,294 as it claimed 134 lives in the past 24 hours, according to the Health Ministry. A ministry spokesman said the total number of people confirmed to be infected is 53,183, adding that 4,035 were under observation, a term that may mean they are in a critical condition. Of the total number of people who were diagnosed with the disease, 17,935 have recovered. Iran is the country most affected in the Middle East by the pandemic. Iraq has thousands of confirmed COVID-19 cases, many times the 772 it has publicly reported, according to 3 doctors closely involved in the testing process, a health ministry official and a senior political official. The sources all spoke in condition of anonymity, as Iraqi authorities have instructed medical staff not to speak to the media. Iraq's health ministry, the only official outlet for information on coronavirus, however, dismissed the sources, reading of the spread of the disease, but the 3 doctors who work in pharmaceutical teams helping test suspected of COVID-19 cases in Baghdad each said that confirmed cases of the disease, based on the discussions among fellow medics who see daily results, were between about 3,000 and 9,000, although they each gave different estimates. Egypt has reported 86 new coronavirus cases, all of whom were linked to travel or were in contact with virus patients. The country also confirmed 22 new recoveries, including a German national and 21 Egyptian citizens, according to a health ministry statement. The number of cases in the country has reached 865, including 201 recovered patients and 58 deaths. More than 900 people died in Spain over the past 24 hours for the second day running, although the rate of new infections and deaths continued to slow. Spain has the world's second highest death toll after Italy with the virus so far, but health ministry figures confirmed a consistent downward trend in the rate of new cases and fatalities. The latest numbers show the rate of infections up by 6.8%, compared with 7.9% on Thursday and 20% in the middle of last week. Scotland's government today confirmed 399 fresh cases of the new coronavirus, as well as 46 new deaths, bringing the country's total to 3,001 positive cases with 172 deaths. The country's First Minister, Nicola Sturgeon, confirmed the new cases during a regular news conference to discuss the ongoing new virus pandemic in the country. Sturgeon also confirmed the country's National Health Service, the NHS, would be increasing its testing capacity to around 3,500 tests a day by the end of April, a move the First Minister said was slightly more ambitious than the UK's target. Scotland, like most other countries in the region, is experiencing a government-enforced lockdown, with people being asked to stay indoors unless on essential errands and the closures of schools. Authorities in Pakistan's Sindh province today imposed a complete lockdown, limiting large gatherings during Friday prayers in order to stem the spread of the new coronavirus in the country. The decision to lock down places of worship came after consultation with clerics of different sects, with authorities now requesting people pray at home instead of going to mosques. During the lockdown, all markets, shopping malls, restaurants, public beaches and other public spots remained closed. Public transport also remained shut, while schools, colleges and universities across the province have been closed until the end of May. Pakistan has so far seen 2,450 cases of the new virus, with 1 reported death. It's a cutting-edge piece of tech that could keep patients safer. A hospital in Belgium is testing the UVD robot. It uses UVC light to effectively kill microorganisms such as viruses, bacteria and spores, and also the new coronavirus. The process is called ultraviolet germicidal irradiation through UVC light. And to show what it can do, stickers are placed in an empty hospital room, even in hard-to-reach spots like the bottom of a TV set. The UVD robot even warns people to leave the room before it starts the disinfectant process. UVC light is the strongest type of ultraviolet light, and the idea of exploiting its germs-killing power is not new. What sets this robot apart from other UVC types is its ability to drive itself and self-operate inside a room.